All right. Well, hello everyone, and welcome. Welcome this Friday. Happy Friday, everyone. All right. Sorry, just I'm still getting used to live streaming on Instagram because with Instagram it doesn't automatically like I use a program StreamYard that automatically live streams to YouTube and my Facebook page, but not to Instagram. So I have to manually go into Instagram and then it looks and then manually start the video there. So just so looks like I'm live on Instagram, and and again, welcome. Thank you for joining me on this Friday. Hope everybody's doing well, and figured I would pop into Facebook, YouTube, and Instagram to see if there are any questions people have. And I was on a few weeks ago, so it hasn't been too long, but yeah, before diving into questions or seeing if there are any questions, let's go ahead. For those who who are not familiar with me, I do have some resources. And again, my name is Dr. Eric Osansky, and I have a podcast called SaveMyThyroid.com, or called Save My Thyroid, which you could find by visiting SaveMyThyroid.com and clicking on podcast, or you could visit your favorite podcast platform. So the podcast, whether you have hyperthyroidism or Hashimoto's, you'll benefit from most of the episodes. But as it says here, there is a little bit more focus on hyperthyroidism, just because there's not a lot of. Most podcasts focus on hypothyroidism, Hashimoto's. So this is one of the few podcasts where I try to. Again, there's plenty of content for those with Hashimoto's as well, but you'll notice there's a little bit of emphasis on hyperthyroidism, and especially with some of the solo episodes. NaturalEndocrineSolutions.com. So that, hard to believe, 15 years is when this website was launched. And this has hundreds of articles, blog posts for those with hyperthyroidism, Hashimoto's. And then I have a supplement line, which you can by visiting ThyroidSave.com. And then I have a new newsletter that came out a couple of months ago. So called Healthy Gut, Healthy Thyroid. You can visit it by going to the website SaveMyThyroid.com/newsletter. And then I have a few books: Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, which is now in its third edition. It was released originally 2011, and 2023 third edition was released. Hashimoto's Triggers, very comprehensive book discussing the different triggers of Hashimoto's. That was released in 2018, so again, about 7 years ago. And then my most recent book, The Hyperthyroid Healing Diet, released in 2024, so last year. And then YouTube, SaveMyThyroid.com/YouTube, just hit 8,000 subscribers, so that's pretty cool. And then SaveMyThyroid.com/quiz is my Save My Thyroid quiz. And yeah, if there are questions, definitely let me know. We have so we have Kim from Virginia. Thank you so much for joining us, Kim. All right, and let me, for anyone who trickles in late, we'll leave some of these resources up. But yeah, so if there are any questions, so far there are no questions, which is okay if there's no questions. But yeah, what happens with these live streams, sometimes we get questions right off the bat. Sometimes we get no questions until I'm ready to sign off, and then we get like one question, and then one question leads to like a chain reaction of different questions. So that might be, and then every now and then we won't have a question, which is fine. It means that I could spend more time creating content, because I have still I got to work on my newsletter that's coming out this Sunday, and comes out every Sunday morning. And then yeah, and then anyway, I have my podcast that I have episodes for. And so so if there are no questions, that is perfectly fine. If I'll just stick around for another 30 seconds or a minute just to make sure that there are no questions. But Yeah, and this probably will be the last time I'm here for a while, because I probably won't be on next week, and then I'll be out of town. Actually, I might be back in town by the time the following week comes, spring break. Oh, actually, no, 2 weeks from today, I'll be heading out of town, and then the following week, I might be back in town to do another one. We'll see. I'll do at least one. I try to do at least one or two a month, but let's see. So we have Kim says, I need to know what I should do to start. Been hyperthyroid for probably a year and a half. Never felt too weird because I'm a high energy person normally. I mean, the most important things to start with is, I mean, first of all, you want to be safe with the symptoms. Like if you do have, if you have hyperthyroidism and your levels are elevated, you want to make sure that you're either taking anti-thyroid medication or taking natural agents. Like when I dealt with hyperthyroidism, I personally dealt with Graves' disease, and I took the herbs bugleweed and motherwort. Some people rely on methimazole, others on PTU. And then you want to make changes to your diet and lifestyle. So, and again, I talk about this, the hyperthyroid healing diet. Also, you could visit my podcast and you could type in like keywords, like do a search for diet. You could do a search for stress. I mean, just sleep. So, but my book, The Hyperthyroid Healing Diet, really is the one that focuses on diet and lifestyle for hyperthyroidism. And then, yeah, then, I mean, a lot of people need to go beyond the diet and lifestyle, which I talk about a little bit in that book, but that's what the other books are for. The Natural Treatment Solutions for Hyperthyroidism and Graves' disease and Hashimoto's triggers really get into greater detail about finding, removing triggers, healing the gut. Also, my free newsletter, Healthy Gut, Healthy Thyroid, you might want to save up. I mean, sign up, sign up for that. Just that has a lot of good information on gut healing and thyroid health. So it was non-toxic nodule goiter. Yeah, so you were hyperthyroid for a year, or you, yeah, so maybe you're not hyper, because non-toxic suggests that it's not hyperthyroid. But I do have some information on nodule goiter. Typically, you want to look into things such as insulin resistance, problems with estrogen metabolism. Inflammation itself can be a factor. Sometimes iodine deficiency, definitely controversial in the world of thyroid health. But yeah, again, all these resources that I listed are either free or low cost. The newsletter, of course, is free. My books are low cost. And then the other page, the podcast is, of course, free. My website is free, the articles and blog posts. All right. Anything else? Any other questions or comments? What's the difference between what I have in Graves and does red mint salt have iodine? It does. Red mint salt does have it has like natural iodine. I don't think it's like added iodine, but yeah, it does have small amounts of iodine. Graves is autoimmune. That's when you have elevated T3, T4, depressed TSH, and then you have elevated thyroid stimulating immunoglobulins, TSI, which is a type of TSH receptor antibody, or TRAB, where non-toxic multinodular goiter is when you have multiple nodules in the presence of a goiter, which is swelling of the thyroid. And so, yeah, Graves, the big thing is it's autoimmune, but non-toxic, you mentioned you're hyperthyroid, but not non-toxic usually suggests that it's like toxic multinodular goiter is hyperthyroidism in the presence of a multinodular goiter, multiple nodules in a goiter, but non-toxic typically means that you're not hyperthyroid. So Jane Elizabeth says, I have Graves, hyper, was on methimazole 2.5 milligrams. Doctor told me to come off as I was getting in range. My latest labs were normal, but perhaps not optimal. She's still very inflamed all over. I'm sure I am insulin resistant. Still have TSH receptor antibodies. Endo says she can't help me any further as I'm in range. I'm exhausted, still gaining weight, and can't get inflammation down. So, and then it looks like you have a follow-up. Explain to endocrinologist I would like to get into remission. She indicated there was no reason as my thyroid numbers except TRAB. She basically said to live with the weight gain. Yeah, I mean, most endocrinologists are, again, they're not going to do anything to address what's the problem. They're just going to focus on the thyroid. Many don't even test for the antibodies. And so I would say, again, I'm going to, of course, say to make diet and lifestyle changes. Again, the hyperthyroid healing diet, if you haven't read that, would highly recommend that. But then again, some people do have to go beyond the diet and lifestyle. But you always want to start with the foundation. So you wouldn't want to start with just doing a lot of testing without at least doing the diet. I mean, I do have people that work with me and they're doing the diet and they're doing some functional medicine testing. But if you're going to choose between one, make the diet and lifestyle changes that I talk about in the Hyperthyroid Healing Diet book. Just keep in mind you might need to go beyond that. But yeah, there's definitely hope to restore your health, get the inflammation down. And I mean, endocrinologists, they deal more with insulin resistance, type 2 diabetes than they do with Graves typically. So that's, I guess I still shouldn't be surprised that she kind of blew it off, but her focus sounds like it was mainly on the Graves and not really on the other factors. But yeah, so always good to work, always a good idea, I think, to work with someone like a functional medicine practitioner. But if you're not ready to do that or can't afford to do that, at the very least, I mean, take advantage of the free information on my podcast, Save My Thyroid, the Healthy Gut, Healthy Thyroid newsletter. Make sure you sign up for that. But again, you might want to also check out the Hyperthyroid Healing Diet book as well. All right, let's see. See, this is what I said. It looked like we might have no questions, and all of a sudden they start rushing in here. We have Christine says, I have no antibodies, but my doc says I have Graves. Is this possible? Thank you for this group. All T, so the T3, T4 are elevated. And yeah, no worries about typos. So, I mean, it's possible. I guess I'm not sure how she came up with the diagnosis, though. I mean, typically, the 3 ways to diagnose Graves, the number one is by having the elevated thyroid antibodies, the thyroid stimulating immunoglobulins, or TRAB, TSH receptor antibodies. If someone has symptoms of thyroid eye disease, like bulging, swelling, double vision, then that usually suggests that it's Graves. And then a lot of endocrinologists still do the radioactive iodine uptake test, which the radioactive iodine uptake test, if it's an elevated uptake, that is typically indicative of Graves. I mean, if someone has elevated antibodies, they typically don't need to do that test. They could do an ultrasound if they want to look at nodules. But so it's possible. It's just, I wonder how she came up with that diagnosis, because it's possible it could be subacute thyroiditis, or if you have, some people have negative Graves antibodies, but they have the antibodies for Hashimoto's, and so they have like what's called Hashitoxicosis. But they'd have to test the thyroid peroxidase and thyroglobulin antibodies for that. So yeah, again, it's a lot of endocrinologists don't have a lot of experience with Graves, so it's not uncommon for them to misdiagnose. Okay, and Jane said that, yes, have your books, making changes for sure. She also tested TPO, which was great in 600. Yeah. So, all right. Well, cool. Well, thank you for investing in my books. Yeah, definitely follow the information there. Those are starting points. If that's not enough, which a lot of people, it's not. That's why I have a whole section going beyond the hyperthyroid healing diet, which is kind of like with the first book, Natural Treatment Solutions for Hyperthyroidism and Graves' disease, and as well for those with Hashimoto's triggers. But yeah, thank you for investing in the book. All right, so Michael said, I would like to try LDN. Yeah, so LDN, low dose naltrexone. I mean, I don't prescribe LDN, so you would have to go to a practitioner who does, or visit like LDN Direct, either I think it's .com, it might be .org, but where you could schedule an online consult with the practitioner and order LDN. It's pretty reasonable to do that and to modulate the immune system. So if that's for someone who has Graves or Hashimoto's, and again, the LDN, if it works, it does a good job of modulating the immune system. If the problem is it's more hit or miss, and obviously it's not addressing the cause of the problem. So, again, there's a time and place for it. But yeah, so that again, just maybe look into ldndirect.com especially if you're located in the United States. All right, endocrinologist, this is Jane again. Endo takes such a narrow focus, was not keen on me sharing NIH research about Graves. Yeah, I bet. We'll continue to check out your resources. Thank you for all your share. Yeah, you're welcome. Thanks, Jane. Jane, thanks for looking and reading my books, ordering my books, and looking into the information as well. All right, let's see. So Karen has had Hashimoto's for 20 plus years. Iodine was good in August and December was high. Not sure if supplements, water. Can someone form hyperthyroidism because the iodine just goes high, or just exposure? I mean, iodine can cause issues. It could cause hyper or hypo. But are you asking, can some form of hyper cause the iodine to go high? I mean, the thing is also, I don't know if you tested in the blood or urine. Blood is heavily influenced by what you eat, or if you take supplements. So your iodine might look good one day, and then if you eat a meal that's higher in iodine, it could potentially spike up. So yeah, I don't like testing for iodine in the blood. Urine is better. Still not perfect. So I don't know if you did a urine or a blood test, but it sounds like it might have been possibly a blood test. So now you're hyper. Okay, it's awful. Having heart symptoms as well. I do have both antibodies. Taking bugle wheat tincture from naturopath. Better, but still not great. New Endo Monday. Test suggestions. I mean, the endocrinologist is probably not going to do a whole lot of testing. I mean, obviously, you've got in the thyroid panel, you've had the antibodies. They might do a basic like CBC with differential, comprehensive metabolic panel, maybe a lipid panel. But I do like to see vitamin D. I like to see an iron panel. I like to see B12. I like to see C-reactive protein. I like to see homocysteine. I like some functional medicine testing, like adrenal testing, either saliva testing or dried urine testing. The Dutch test, again, they're probably not going to do that, but sometimes gut testing, but not always. So, yeah, so those are, and again, I talk about I'm pretty sure I talk about these in my books. I know Hashimoto's triggers I do, and the hyperthyroid books as well. I'm pretty sure I get into like the different types of tests. So, but those are some of the ones. I mean, it's just as far as like blood testing, because they're probably not going to do any functional medicine testing. Those are some that you could ask, but just keep in mind they usually do minimal testing. So is the treatment different for Graves and other hyperthyroid issues? I mean, yeah. I mean, symptom management wise, if someone has Graves and then another person has toxic multinodular goiter, from a symptom management perspective, they might take bugleweed or antithyroid medication. But as far as addressing underlying causes, yeah, like there will be differences in addressing the autoimmune component of Graves compared to non-autoimmune hyperthyroid conditions. All right. Thank you. Just received your book. Wonderful. Thank you for letting me know. Okay. And Michael had the question about the LDN. You are welcome. Let's see. And then Patricia said, I'm nervous about gaining weight and getting hypothyroidism. Does everyone go from hyperthyroidism to hypothyroidism? No, not everybody goes. I mean, some people do. And if it's due to the medication, the antithyroid medication, it's usually temporary. It's usually not something where someone's going to be taking um, the medication and they'll become permanently hypo. But if someone has the antibodies for both Graves and Hashimoto's, then they could kind of switch over eventually from hyper to hypo, and they might be looking at a long-term hypothyroid issue. But in that case, the approach is the same. You want to address the autoimmune component. You want to find, remove triggers, do things to heal the gut. All right, and Karen said, yeah, it was a blood test. Yeah, that's what I figured with the iodine test. You are very welcome. And then Patricia asked, will this be available to watch at a later time? Yeah, it should be, I don't know, on Instagram. So those who are on Instagram, maybe not. Oh, actually, I got to check Instagram, see if there are questions. That's the questions don't come over on StreamYard with Instagram. But YouTube and Facebook, it should be available later on Instagram. I'm not sure. So let me see if there are questions on Instagram. I don't know how to scroll. This is like, there are some questions, earlier questions on Instagram. I just don't know how to like scroll up here, like to see some of the early questions. Oh wait, is this actually maybe this? Oh, there we go. So on Instagram, someone says I have both a large toxic thyroid nodule as well as positive Graves antibodies. Would RFA, which is radiofrequency ablation, be benefit for me as the nodule has grown and is about 5 centimeters? I mean, I'm always going to say try to look into the cause of the problem, but that is a pretty large nodule, especially if you have any type of obstruction. Anyway, like 5 centimeters is large. It's not to say you can't do things naturally. For the nodule, of course, the RFA is not going to benefit the autoimmune component of Graves, but it might be worth looking. If you consult with someone like Dr. Angela Mazzo, who was on the podcast, she does RFA. I'm sure she will recommend, or not sure, but she probably would recommend to do the RFA. But yeah, if someone's gonna look into RFA, this is one situation when they have really large nodule, 5 centimeters. But again, I still recommend addressing the cause of the problem. It's not like you can't do both, but a lot of people, when they get the RFA, it's like, okay, I just got the RFA and that's all I'm going to do. And again, for those who that's what they want to do, that's perfectly fine. Been taking 2.5 milligrams of methimazole for the past year and a half. And does Graves cause the growth of thyroid nodules? Like Graves is associated with inflammation of the thyroid, which could lead to thyroid nodule formation. So there could be that relationship. Doesn't always. Like I didn't have nodules associated with my Graves condition, but it is possible. And then another question here. After having COVID 5 years ago, I was diagnosed with Graves. Is your remission strategy any different with those people? I don't know if you'd say it's different. The way once 2020, especially 2020, 2021, we had a lot of people come in with COVID who had it trigger Graves. But I look at it more as a straw that broke the camel's back. So it's still addressing other triggers, other underlying imbalances, healing the gut. So I can't say it's different for someone who sees me, where everything started with COVID-19. All right, let me get back. I'll check again Instagram. Let me see. So thank you for answering my questions. Patricia, you are very welcome. Okay, and then Joshua. Is there a better type of medication I can use instead of levothyroxine that has I'm not sure. That is okay. I guess you're saying that levothyroxine has bad side effects like digestion, nutrient absorption. Yeah. levothyroxine, obviously it's synthetic T4, and one of the issues is T4. Some people have issues converting T4 to T3. So I don't like personally, well, and you're not asking if I have a type of thyroid hormone replacement, but yeah, I mean, Armor, NP Thyroid are options that, in my opinion, might be better options for a lot of people. Some people, it's compounded T4, T3, or some people just adding T3 like Cytomel. Some people have add glandulars like Thyrogold is something you get on your own. But I mean, if I was dealing with hypothyroidism, I would probably look more into desiccated thyroid hormone. Not all doctors want to prescribe it, but that's what I would look into. All right. Let's see. Can you speak to how to bring down ferritin and C-reactive protein? Will they potentially come down with quality lifestyle changes? I mean, usually, sometimes it's challenging. I've had some people where the ferritin and CRP is stubborn and it remains high, and we're trying to figure out what's lowering, like what's causing the elevation. So there are people that follow even like an AIP diet, which is a autoimmune protocol, and their CRP and or ferritin remain elevated. And sometimes you'll only have one or the other. They're both inflammatory markers, but they're different types of inflammatory markers. So it is possible to have one but not the other. But I definitely would start with diet and lifestyle, and then if necessary, you can dig deeper, do more, like can do like functional medicine testing that I talk about on my podcast and in the books. All right. So Karen asks, is it common to go from Hashimoto's to hyperthyroidism? I've had a nodule for years, and now have three. Could that play a role why I went hyper? I won't say it's common I mean, it's more common for people to go from hyper to hypo. And again, not everybody will, because someone asked that question earlier. But yeah, not as common, but I've had people. I have had a number of people over the years who had a history of Hashimoto's and then eventually developed hyperthyroidism. Some people had Hashimoto's and developed Graves, so they had the antibodies for Graves, and then some people didn't have the autoimmune component. I mean, the nodules, sometimes nodules can be turned, like people can have toxic nodules, which could lead to hyperthyroidism. All right. So Diane, can I fly with hyperthyroidism if my thyroid hormones and TSH are in optimals and TSI antibodies are negative? Can you, okay, fly like on an airplane. Can you fly with hyperthyroidism? My thyroid hormones and TSH are optimals and TSI antibodies are negative. I still have elevated anti-thyroid globulin and thyroid peroxidase. Says altitude affect my condition, especially if I'm pregnant. I mean, pregnancy, I would bring bring that up to like your OBGYN. But as far as thyroid, I'm not concerned. Like if someone, especially if their thyroid is normal, but they have elevated antibodies, I've not seen any evidence of like the altitude increasing, like worsening the autoimmune response or affecting the hormones, like causing a relapse. So if that's like where you're concerned, like you're pregnant and will that things get worse or relapse as far as the TSI coming from negative to positive, or I haven't seen that. So to me, it's not a concern. Like if it was me, I wouldn't like be hesitant. Like I wouldn't really be thinking twice. Should I not fly? Because yeah, in that situation. So I got pregnant in remission, but did not stop Bugui totally yet. I'm now in half dosage. I'm not sure if to stop or take it to continue gradual reduction. I mean, Bugui, there's no research with pregnancy. So I know Kerry Bone, who is a master herbalist, recommends not to take bugleweed while pregnant, just because we don't know what side effects someone might have. And dairy is not recommended. It's not the lactose or the iodine. So lactose free isn't the solution. It's really the casein. A lot of people are sensitive. It's a common allergen. So that's the main reason for the avoiding dairy. And then, as you already mentioned, completely got into remission with optimal hormone levels, TSH 1.5, negative TSI. My TPO improved, but still 134, and anti-thyroid globulin antibodies not changed last year. It's 216. Does this mean I have to find another trigger to get rid of Hashimoto's antibodies, or does it just take some time to move? I had also grazed, but now finally got rid of antibodies. I mean, yeah, it sounds like you might need to dig deeper. And I don't know if you've read or even skimmed through my book, Hashimoto's Triggers, but there's definitely a lot of different triggers. So sometimes it could be a little bit challenging to find the trigger, and having a healthy gut's important. So definitely check out Healthy Gut, Healthy Thyroid newsletter. Every week during the newsletter, I go over a different test, sometimes just sometimes a blood test, sometimes a functional medicine test. So definitely, those who have not signed up, visit savemythyroid.com/newsletter. Are there any tests that should be done to confirm if I have Hashimoto specifically, or simply have hyperthyroidism or hypothyroidism? Well, I mean, the thyroid panel will confirm if you have hyper or hypo, but the antibodies you would want to do for Hashimoto's, thyroid peroxidase or TPO antibodies or thyroid globulin antibodies, those are more commonly associated with Hashimoto's, even though a lot of people with Graves also have TPO antibodies. And thyroid stimulating immunoglobulins, which is a type of TRAB, TSH receptor antibodies, those are more specific for Graves. So, I mean, if you wanted to test all three and see if you have any of those, that wouldn't be a bad idea. Yeah, Joshua, I'm going to see if there's any questions on Instagram, and then I'll get back to you. Which I don't think so. I don't think there are any other questions on Instagram. All right, so Joshua, why don't I hear much talk about the importance of health of the mitochondria to our health, like our hormones? I had Graves for 20 years, and none of my doctors have done any tests on my mitochondria. There's not great testing on mitochondria. I mean, organic acids testing will look at some of the mitochondrial markers. So, I mean, I agree. I mean, mitochondria, I just recently released a podcast episode, talk about mitochondria and thyroid health. But yeah, I mean, most doctors, like regular doctors, aren't going to do testing, any functional medicine testing. So they're not going to typically do adrenal testing for like looking at circadian rhythm of cortisol. They're not going to look at a comprehensive stool test or mold testing. So yeah, they're definitely not going to, like an endocrinologist or primary care doctor won't be looking at mitochondria. But even a lot of functional medicine doctors don't do like organic acids testing, which is where you would want to look at mitochondria. So, but I agree. I mean, I can't say I do that on every person, but if I was working with someone who had Graves for a long time and they've done different types of tests, yeah, like I would do like organic acids test that looks at not just mitochondria. It looks at, it's more of a broad spectrum test, looks at yeast and fungi markers, certain bacterial markers, looks at oxalates, looks at certain nutrients, some indicators of detoxification, some of the neurotransmitters. So yeah, I definitely do like that test. All right, I'm going to take a quick sip of water. If there's any other questions, I could go for another like 10 minutes if there's any other questions. Just making sure, make sure I didn't miss any questions here. And double check Instagram. Again, if there's no other questions, that is perfectly fine. Michael, asked about or just mentioned black cumin seed oil, which I like black cumin. Black cumin, really good anti-inflammatory. So there's actually been at least one, if not a few studies showing that it could help with Hashimoto's, but I think it's not specific for like Hashimoto. So I think someone with Graves could also benefit. Also, I um, during 2020, like I think it was the fall of 2020, I brought up some studies showing that black cumin could potentially help with COVID-19. All right. Joshua says, thank you so much for your great information. Yeah, you are welcome, Joshua. Thanks for your questions. Appreciate everybody asking questions. Or not everybody. I'm sure there are some people tuning in, listening to other people's questions, which also I appreciate you. That's perfectly fine. I do that sometimes too on other like Facebook Lives or other live calls. So Jane says, if your thyroid markers are in range with the exception of antibodies, is there any reason to just live life and not worry about the antibodies? Are you in more risk of symptomatic release? I mean, the main issue with not with having antibodies and not like if your thyroid looks great but you still have antibodies is if you have one autoimmune condition, you're more likely to develop other autoimmune conditions in the future. Doesn't mean you definitely will, but I, I, again, I'm not always successful in normalizing antibodies. I don't think there's any practitioner who has a perfect record, but that's what I aim for. But at the same time, like if someone has tried so many different things, I mean, I hate saying, yeah, just throw in the towel and just don't. Oh, actually, I don't know how that just switched over because I didn't even touch anything. But um, yeah, anyway, like again, if someone's been doing a lot of things, diet, lifestyle changes, functional medicine testing, and antibodies are still high, that, yeah, I mean, I guess you could say there's a time and place. I mean, again, especially if someone doesn't have a lot of money, but even if they do, does someone want to spend? I mean, it's up to the person, obviously, how much testing they want to do. And sometimes it could be challenging to find the trigger or triggers. Usually there's multiple triggers. And um, so, yeah, I mean, I know it would bother me if I still had elevated antibodies, but would it bother me like indefinitely where like all the time I was thinking of it? Like if if my Graves antibodies didn't normalize. And thankfully that's all I had was the TSI. I didn't have thyroid peroxidase or thyroglobulin antibodies. But if let's say if I had TSI that didn't go down, I'm sure, I mean, definitely would have bothered me back then. Would it still be bothering me 15 years later if I didn't have any other health issues related to that? Yeah, I don't know. Yeah, I'm not sure, but uh, yeah. So, and there's different perspectives. Some practitioners, even functional medicine practitioners, don't pay as much attention to the antibodies. But yeah, again, I do like to see them get as low as we can. Normal is always great, but if someone can't get them for whatever reason, normal, I mean, yeah, obviously, you do what you could do. I wouldn't prevent it from like living a happy life and I don't like the word worry regardless. Like I wouldn't worry about the antibodies, but would you not want to still focus on the antibodies? Like I said, there's a lot of different things to consider, including how long someone has been taken to try to lower those antibodies in the first place. Is a vegan diet helpful for Hashimoto's? I mean, I recommend more of a paleo or AIP diet. So I can't, I mean, the problem I do work with some vegans and vegetarians, but if someone's going to do that, you want to follow a healthy vegan diet, and getting enough protein is important, which isn't as easy to do. So, yeah, so I can't say a vegan diet is specifically helpful for Hashimoto's. At least that's my opinion. And a lot of practitioners I've had on the podcast, and when I have people on the podcast, I don't like screen them out. I don't like, I mean, yeah, like I wouldn't like if like half the time I don't know if they like recommend paleo or vegan or something like that. I mean, I'll do my research, but I'm not listening to like every single episode or every like podcast they were on or things. So sometimes they might be a vegan and so nothing against someone who's a vegan vegetarian, but A big thing is getting enough protein, and not all vegans, but a lot of vegans, they're still eating a lot of like processed foods and carbs and unhealthy foods. Again, there are definitely healthy vegans. And so I wouldn't say that's beneficial compared to like a healthy paleo diet, yeah. So anyway, I would say it's not necessarily helpful from my experience, but if someone is vegan and they're eating a healthy diet, they could definitely restore their health as well. Christine says, thank you. You are welcome. And Karen, thank you, Colleen, for sharing your time and knowledge. Very much appreciated. Yeah, you are welcome, Karen. And Jane, thank you. Appreciate all. We got Jianri says thank you. All right, I'm going to start wrapping up here. But Karen says, what have you found to be the best stress reduction? I have certain stress has played a huge role in my health. I mean, I think just even simple deep breathing could be beneficial. I like something, and again, most of my patients just do like deep breathing meditation. There is, oh, here we go. Just creating a banner here. So I use something called Heart Math. They have the Inner Balance, which for like your iPhone or Android, as a type of biofeedback, measures what's called heart rate variability, and you want you want variation in between heartbeats. If you visit my website, naturalendocrinesolutions.com, and type in heart rate variability, so yeah, here's my website, naturalendocrinesolutions.com. You could do a search, heart rate variability, and learn more about that. But again, most people aren't doing that. At least most of my patients aren't doing that, and most people just in general aren't doing that. But that's something that I like for stress management. Okay, where do I purchase your books? You could go on Amazon. You could just go on Amazon and purchase them. You should maybe even Barnes and Noble. Some of them, I know. Yeah. Anyway, Barnes and I mean, I think where all bookstores are found, but most people purchase them on Amazon. How can I reduce elevated TRAb antibodies? Such a quick question, Daisy, but it's not a quick answer. So I'm going to refer you to my podcast. I just released a few months ago, like a series of episodes, like 6 episodes on antibodies, lowering antibodies. If you don't want to go through those, start with savemythyroid.com/50. I have just a general episode on lowering antibodies, but any of my books are going to talk about like that lowering, like doing things like your TRAB. So you talk about hyperthyroidism. So hyperthyroid healing diet, essentially, it will show you how to lower antibodies using diet and lifestyle. And the natural treatment solutions for hyperthyroidism and Graves' disease talks about like different triggers. And my Healthy Gut, Healthy Thyroid newsletter, definitely check that out because I talk about different triggers and healing the gut, which is also important when it comes to normalizing antibodies. All right, Karen, awesome. Thank you again. You are very welcome. Thank you so much, everyone. I appreciate your questions. And looks like we don't have any more questions on Instagram either, which is great. Hey, Sandy, I don't know if you're still on there, but great for hair. I don't know if it was the black cumin that someone mentioned earlier, but yeah. Anyway, I don't know if Sandy's still there, but anyway, thanks everyone for joining. Everyone have a great rest of your Friday. And yeah, Daisy has all 3. Yeah, I mean, again, it doesn't make a difference. I mean, the different antibodies could have different triggers, but check out the podcast again. SaveMyThyroid.com/50. But then more recently, you'll see if you scroll, like visit SaveMyThyroid.com, you'll see, let me go to the following page is where SaveMyThyroid.com. Again, you'll see a number of different episodes on antibodies. So yeah, there's actually a good amount. If you just go to SaveMyThyroid.com, type in antibodies, you'll see there's a lot of episodes. Yep. Okay, great. You are welcome. Diane, thank you. Thanks, everyone. Take care again. Great rest of your Friday. Great weekend ahead. And catch you sometime in April. Take care, everyone.